Minister, I would support this particular amendment. I believe that the sunset for this legislation should be black and white. It should be set in stone, and it shouldn't be extended beyond the 9th of October. And I genuinely believe, Minister, that this legislation is unworkable. And I think it could have been workable if the provision for antigen testing was included from the start in relation to it. We could be opening up our restaurants, our pubs later this week using antigen testing and giving it the exact same status as someone that is fully vaccinated for access. But for over the last 12 months, the government has not addressed the issue of antigen testing. They have referred continually to the health experts in relation to it, and the health experts have taken a particular interpretation based on the fact that the public wouldn't understand a result that they receive from an antigen test. Now, government can take a decision tomorrow morning that antigen tests and antigen results should be sufficient to do that, rather than waiting and plumosing the medical profession to come round to the view that the public are adults and mature enough to understand what an antigen test means. And I would plead with you, Minister, let's open up more of society, but let's do it in a safe manner, which I agree with, but antigen testing can allow that to happen. And Minister, we have this bizarre situation that I referenced at second stage during my contribution, where in relation to indoor dining, you have to have your vaccination certificate, but yet you can go to a cinema and you don't need it. We have the Chief Medical Officer telling us now that children under 18 years of age shouldn't go into restaurants. But in the exact same atmosphere, we can have children going into cinemas. So again, there's a contradiction in relation to the advice that is being given here. And I think the fundamental issue here is that vaccination status should never define someone's access to pubs or restaurants or wider society here. And we cannot have a situation where this particular law extends beyond the 9th of October. Now, I, for one, would actively encourage every single citizen in this state that gets the opportunity, and where it's safe to do so, to take the vaccine when it's made available to them. But there is this coercion in this legislation, and I cannot accept that, Minister, and I would urge you to look at the antigen testing as an alternative avenue and to implement it in tandem with the provisions that are made here. Can I ask you, Minister, when you're responding, if you could provide some clarity for me in relation to the certificate for someone who has recovered from COVID-19. And the public commentary that we've got to date is that someone who, for 6 months after they've recovered, can go into a pub or restaurant and they will be certified to do that. Now, who's going to provide the certification? I don't know, and I know there's confusion in relation to that. But that is a direct contradiction of what is on the HSE website, which clearly states that someone 9 months after infection is immune, is protected, and should then be able to go into a pub or restaurant. But we're saying that we're only going to allow them in for 6 months. So why the contradiction in relation to that when it is public health advice, when this is what the medical experts are actually saying to us? And again, the final point I'll make to you, Minister, is the advice, the medical advice, the public health advice is that a PCR test allows someone to travel, allows someone to come into this jurisdiction, but doesn't allow someone to go into a pub or a restaurant. Again, there's a direct contradiction here in the public health advice. We can get onto a plane with a couple of hundred more people in a very confined space, potential risk of spreading a virus. A PCR test will allow people to do that, but it won't allow them to get off the plane and go into a pub or a restaurant with the exact same results. So these contradictions, Minister, are adding to the absolute confusion in relation to it. I believe this legislation is completely unworkable. I think there will be premises that will open and will find that they cannot remain open because they cannot enforce this and will be forced to close again, which is in no one's interest. We want to see society open and to remain open, and at the very minimum, Minister, I would urge you to accept this amendment and set in stone the 9th of October as the final date for this legislation. Thank you.
Thank you very much.